Welcome back to another episode of The Learning Curve. I am your host, Dr. Irtaza Asar, and this is a podcast where we highlight educators, innovations, and ideas reshaping medical training. Today, we're going to be diving into one of the most powerful tools in emergency medicine education, simulation. Once seen as a luxury, simulation is now a necessity, especially in a field like emergency medicine where critical moments are high stakes and high consequence, but often underrepresented in actual clinical exposure. For students and residents alike, simulation creates a safe but pressure-filled space to build clinical confidence, sharpen decision-making, and develop the teamwork that emergency care demands. When done right, it's not just about practicing procedures, it's about preparing for reality. Joining me today is an expert, Dr. Elton Banks. He is a graduate of the University of Kentucky and is currently working there as an associate professor. And he is passionate about using simulation to transform the way we train the next generation of emergency physicians. Together, we're going to explore why simulation deserves a permanent place in every curriculum. And we're going to talk about how to scale it across learner levels, from medical students to residents, and practical tools that you can use to implement or level up your own simulation program. So let's get into it. Elton, thank you so much for joining me today. I really appreciate your time.
Thanks for having me. I really appreciate the opportunity.
Hey, one of the things that we've done with every single guest that we've gotten on is I asked them, what is their special secret superpower? What's yours, if you wouldn't mind sharing with the audience?
My special superpower. I don't know. I'm really good with plants. I'm sitting in my kitchen right now, and like in front of me, I can see all of my beautiful flowers. Like it's like a mini conservatory out there.
That is
So yeah, that's
awesome.
my special superpower. My plants actually live and they blossom and they bloom and they're amazing.
Love that. And my hope is that the next time you're at a conference and somebody's listening to this podcast, they come and talk to you about botany and plants and how to grow plants. For me personally, I suck with that. Thankfully, I have family members that can help me, but that's an awesome superpower, man. And I think that's actually a great segue into simulation. To set the stage for this conversation, let me ask you this. Why do you think simulation is so critically important, and why should we prioritize it in emergency medicine curriculums?
I think that simulation provides a gateway for students to learn emergency medicine without the extra added stress of actually being in front of the patient. But it creates a safer zone, a safer space for them to, really hone in on those skills and not feel so pressured, if that makes sense. We always tell our residents, this is a safe zone, this is a safe space. We're not here to make you feel like you're less than or this or that. We're here so that you can build a foundation so that you can learn these cases in real life. You can look back and say, oh, wait, this is basically this, just in the real situation here. So just takes a little bit of the fear away, but also it kind of, helps set the stage specifically.
Yep, I love that. And, that's something that I've tried to hone in on with my residents as well, is that there are certain things that it's very hard to practice in real life. Like an example would be like a thoracotomy. It's a high stress, high impact moment. So if you can actually map out the steps to doing a procedure, that can really help you succeed when it's actually crunch time. So you can
Mhm.
map out mentally, okay, this is what I have to do. This is the first step. This is the second step. This is the pitfall here. And you have this environment that right now there's not a lot of stress. So simulation can help you create that opportunity to help these learners, especially in high stakes situations. And it doesn't necessarily even have to be high stakes. And we'll talk about some other ways that we can kind of integrate that as we get into the episode. But are there any other important reasons as to why you think simulation belongs in emergency medicine?
Let's see. Aside from building confidence and helping with patient care, it's a way of discussion. Like I know a lot of times too, like being in medical school, like we read all the time, like we were in classrooms and then we went to clinicals. But it's a way to kind of like put those things that you actually like learn in the books and that you see in your board questions. It puts it to practice, especially those rare things. So it's really good for the rare thing, like you just mentioned, like the thoracotomies, different procedures that we don't get to do all the time, different ones that we don't see all the time, or different ones that you just may not have seen on your shifts because they just come up, at random times.
Yep.
It's emergency medicine. Who knows what will happen? So aside from building confidence, it's a way of like, honing in on skills that we don't get to see all the time because, with the ACGME, like we have certain skill sets that we have to have before we graduate. And unfortunately, we may not reach all those numbers. And so simulation provides a way for us to make sure the residents are getting that quality learning that they need.
Yep, I absolutely agree, man. And I've always found that I think active learning is much better than passive. And I think simulation affords you a platform where you can basically engage learners in a much more comprehensive way. And I think one of the other misconceptions that I think simulation often gets is that people think, oh, this is just the procedural aspect of things that we can just practice. But I think in reality, I think you can do a lot more than just procedures with simulation. You can teach leadership, you can teach communication, you can teach team situational awareness. So an example would be is if you have an intern that's never run a cardiac arrest, you can create simulation-based cases to basically help them develop the leadership, communication skills, situational awareness that they might not get a chance to practice until it's actual real time. It just affords you an opportunity to help set them up for success. So now we've established kind of the premise as to why we think simulation is so important. Let's talk about how to integrate that into a curriculum. And this is where I want to tap into your experience. Can you talk to me about strategy for integrating simulation into curriculums?
So I guess the way that one thing that our program does, and we try to do it at least once a month now, we do integrate simulation into our, residency curriculum as part of our Thursday conferences. So we have a 7 to 11 conference every Thursday for the residents to come in, listen to lectures, learn, hone in on skills that they need to hone in on, and things that are like bread and butter emergency medicine and the zebras as well. But on one specific day of the month, we do 2 hours where part of that learning is active learning in simulation. Instead of listening to these lectures, they're seeing cases that may involve some of the subjects that we're talking about or some of the cases that we're talking about. And aside from that, too, we have 2 sims going on. We have 2 procedural stations going on as well. So whatever procedures related to those, we just integrate a hands-on, not just sitting down, listening about patient cases. We're going to actually go in and we're going to simulate what we do with these patients in these situations. And we're going to give you, like, since they're residents and not the medical students, we have a different curriculum for those, for the medical students versus residents. It's getting a little harder than the medical students do. Same case, but we'll go a little bit more in depth and in detail with the residents because they're going to be seeing these patients every day in the ER and they'll know how to manage them.
Yeah, I love that. And I think that's one of the things that I've also found is helpful is you have to try to tailor your simulation cases to the learner level that you're working with. So if you're working with medical students, I think it makes sense to work more on foundational skills. So specifically, let's say you have a trauma patient, teaching them about the primary survey or teaching them about handoffs or just basics of resuscitation, I think is really valuable. Whereas with residents, like you're saying, you can start to build cases that have a lot more complexity. You can build multiple patient cases. You can add in ethical dilemmas. You can ask them about halo procedures and you can really integrate all those concepts. And I think simulation really provides you that platform to kind of do that. Can you give me some specific examples of simulation cases that you guys have done that we can use as a reference point?
For instance, we do a lot of peds cases. We do like a lot of cardiology cases. Obviously, for instance, one case that comes to my mind is one that we do and hopefully none of the residents are watching this right now, so I won't give the case away. But we do like an MVC with a STEMI. We get patients who come into the ED a lot of times with one diagnosis or one suspicion of a diagnosis, and it may end up being something else. So you get a patient who comes in, who had a car accident, an MVC, and the residents will kind of tease out throughout the case that this patient was having chest pain. We don't tell them that right when the patient rolls in. They're just working them up for trauma, but the trauma is actually negative. And so what we do is we're trying to get them to understanding that, hey, this is actually a medical case and not an actual trauma case. Of course, the patient's having a STEMI, and when they ask for the EKG, you'll be able to see it. But it's just a way for us to help them not hone in on one thing and keep a broad differential and a broad mindset.
Of that. And I think that's really awesome because really you can use cases like that to help teach nuance. So specifically, hey, you have this bias that this is a trauma patient. I'm going to be looking for traumatic injuries, but in reality, you have a huge medical issue that if it's not recognized promptly, the patient can potentially have a bad outcome. And I think that's a great way to simulate that case.
I was gonna say this.
Yeah.
Sorry. I was gonna say, and it's true too, because we actually that exact case, we've actually had literal patients just like that, like
Yep.
right after this case. So
Yep.
it's
And
kind
I going back to my trauma experiences, that's been kind of one of the pitfalls that you run into is that you get into this trauma mindset, but you don't really take into account other issues that patients can come in with. Now, having said that, I want to tap into your experience again. What do you think makes a good sim case versus a bad sim case? Because there's examples where learners can take away a lot from certain cases, but then there's other cases where the simulation experience might not be as robust. So what really differentiates that in your opinion?
in my opinion, I think a really good sim case is one obviously is related to something that we see in real life, something that's gonna be useful that we see all the time, and maybe not all the time, but something that has one objectives. Let's have these certain points, these important points that we're going to actually go to with the residents and make sure they hone in on these skills and make sure they know these basic things. Not only like having the objective skill sets lined out for us, but also those cases that I don't want to use the word zebra, but they have a component of complexity to it as well. Not just simplicity, but I think the residents also enjoy and appreciate the complexity that we add to these cases so they can think outside the box. Because with emergency medicine, what do we have to do all the time? We have to think outside the box. Things can take a left turn or a right turn at any given moment. Like it's just a popcorn moment, which is why the job is so fun too. But I think that those two things are things that make for good simulation cases.
I love that. And I think one of the other misconceptions that I also wanted to pick your brain about is that people think that high fidelity mannequins are the only way that you can do good sim cases. Are there other ways that you can think about integrating simulation into curriculums without just the use of high fidelity mannequins?
I do think the high fidelity mannequins are 100% a really, really, really good thing to have. But we can also use real patients. I mean, there have been cases, times where I've come to the sim lab and I didn't even realize it. I'm like, wait, we use real patients too? So kind of like your SP, your standardized patients for different things, more so for like procedures. I'll have some people come in and kind of lay there for like the ultrasounds and all those kind of things. But also the residents and the med students we use them as well as part of that learning. As far as other integrating, there are different like online things you can do as well, not just, mannequin wise, but you can also kind of simulate those online as well through a framework.
Okay, perfect. I love that. And I think from my own standpoint, we've had a lot of great sim cases at my program that haven't necessarily involved high fidelity mannequins. We've in fact even run mass casualty events that have had kind of simulations of different kind of disasters and how to be prepared for those, and those haven't involved mannequins. So those are some ways to do it. And one of the other ways that I think that you brought up and alluded to was that you can use standardized patients to basically help to try to tackle any knowledge gaps that learners might have. Specific examples that I love to simulate would be role playing for breaking bad news. Is how can you help your learners deliver bad news to patients, like a new cancer diagnosis, or their loved ones passed away, or a pediatric cardiac arrest, and how do you deal with parents afterwards, and what kind of language to use? And I think simulating that can really help to bridge some knowledge gaps. And again, those don't necessarily involve high fidelity mannequins. It's just a different approach to kind of tackling that.
Yeah. Now, kind of piggybacking off of you, we also we have a disaster like Dr. Blake Davison, who's one of our assistant program directors right now, does a great job with getting our wilderness days and disaster days set up where we go out and we actually simulate how things are in the wild, I guess I should say. The residents tend to really enjoy that as well. Dr. Belcher, he and Dr. Belcher do a lot of things from that standpoint. So the residents do get a chance a few times a year to go out and do things in the community as far as just like in the field or whatnot and simulate actual things. I think most recently they went to we have to Dr. Dahlgren's farm and a big helicopter came and sat down. I wasn't able to make that one, but it was a really good experience for them to simulate some things.
Awesome. Love that. That sounds like a really cool experience from everybody. One of the other things that I wanted to pick your brain about was the integration of multidisciplinary teams. So can you talk to me about that?
Our simulation is not just for our residents and our med students, it's for our APPs, our nurse practitioners, our PAs, our medical students. But then also, like, we get the sim lab is used for the whole hospital. So every service comes there. And there are times where we may have the surgery team come in, and it's kind of rare. Like, we don't have them come in all the time, but there have been times where they would come in and, let us know their perspective. And this is why this is important because we can see different perspectives from different teams. So whereas the ER team is, thinking this and doing this and focusing on this is where things are thought about from a surgical standpoint. And this is how you get the patient, move to where they need to go and like kind of make the ride a little bit more smoother for both teams and for the patient. So integrating other teams into a simulation as well kind of creates more of a safe, organized place where everyone can communicate well and kind of know, where things are going or how things are going to move. It builds a better teamwork framework, if that makes sense.
Yeah, absolutely. I love that. And I think integrating them can also help to break some barriers in terms
Yeah.
of, you have high stakes cases in the future that might happen. You've already built rapport with certain specialists, certain nurses, certain respiratory therapists. And I think just simulating that real ED teamwork, I think, can be so valuable, at least even for the future. And I think, again, this is a low stress environment. You're trying to create that environment where, you can have your learners succeed, but also get to know their team and work on communication and work on those leadership skills. And I think integrating other teams, I think, can be really, really valuable. So having established all this, let's talk about implementation of sim for younger learners, because realistically, all learners are not the same. They're at different levels. And the way you use simulation with a medical student might be very different with what you do with a senior resident. So can you talk to me about what are some things that we can do for our younger learners to help set them up for success from a sim standpoint?
So one thing that I really enjoy about our program is that we start simulation with our students at the medical student level. M1, M2, you're usually in the classroom, like reading. M3, M4, those are your clinicals. And then resident, everything is clinical for the most part, aside from your didactics. And so what we do as far as integrating the younger learners is we have it set up for them. I mean, we just like one of the things that I did last year or during my medical education simulation fellowship is I assisted with creating a GI sim pilot course, which was a case that was developed based on what the medical students actually saw in the classroom, what they've been reading about in the books, what they've been taking tests on. And the purpose of it was to bring them to an actual real life situation that they would see maybe in the ER one day. These students haven't been in the ER just yet, but it's a way kind of just like to set the foundation for them and, break the ice as to what this would look like, not just on paper, but like when you actually have a human in front of you and you're seeing these labs, and you have to know what to order and you have to see this on chest x-ray, you see this on CT, what do we do with these things? Now, in those cases, can we simplify it in a lot of ways? We don't expect them to know the same that the residents know. And so we will just hit points that are more useful for their level right now. Whereas for the residents, we just ramp it up a little bit, okay? Internal level. Let's turn up the heat just a little bit here. Let's see if you can let's see if you can explain why you want these labs. What are these? Interpret these labs for me. Like you should know what these are at this point.
I love that. And I think just to take away some points, I found that for younger learners, I think the key thing is keeping it focused. Specifically, you want to try to make sure that you're tackling one objective per session as opposed to making it five, six different things. So you have the pregnant patient who now has a massive PE and is hypotensive. That's probably not the case for your medical student, right? And again,
Right.
kind of going back to that trauma example, if you're managing a complicated trauma patient, let's just focus on the primary survey.
Right.
Or let's say you have just one isolated medical issue and we're just going
Mhm.
to focus on this problem. So the example would be the crashing asthmatic. We're just going to talk about the nuances towards the asthma algorithm treatment and we're just going to focus in on that because I think especially for younger learners because they already have so much exposure to a lot of different things, they can get easily overwhelmed, and just kind of keeping that
Yes.
scope narrowed I think really helps. And I think you also alluded to this as well, is you really want to normalize a culture where, hey, it's okay if you make a mistake, you're learning,
Yes.
but we're trying to create this environment where you feel comfortable making mistakes so that you can learn, so that when it's time for real time, you're going to be able to execute. One of the best ways that I think somebody framed it for me when I started out as a medical student was, hey, this is a sandbox. You're going to play in the sandbox. You're going to learn in the sandbox. This is not a stage. I'm not expecting you to perform anything. I'm expecting you to learn the material. I'm expecting you to learn the objectives and just grow from that. And I think that ends up being super, super valuable. Is that a conversation that you guys have with your students as
Yes,
well?
that's actually one of my favorite parts to do because I feel like everyone comes in sometimes for that first time, they're so nervous, and I remember being an intern having to do my first simulation case, and I remember coming in there thinking, "I don't know what's going on here. I just got out of medical school. I should know this, but I don't know. What do I do? What do I say? What do I do?" You just fake it till you make it is what what they all tell us to do. But we really do try to create a sense of comfort. I guess comfort is a word that I should use with our residents. Yes, we want you to take this seriously, but we also want you to feel free to express yourself and feel free to not have the answer. A lot of times we're so stressed because, like, in the medical field, like, we want to get the answer right all the time. But we try to stress to our residents that this is a time where you don't have to, we want you to like do your best, of course, but you don't have to stress and worry about, being right in this situation. We're going to help you get there. We're going to help create that framework for you. And we really stress that we don't want you to be nervous. It's more of a discussion like when we're going through. So we do a debrief as well after these cases. And that's when we all get together and sometimes we'll laugh about certain things that went on in the room. We're all human. We have a good time too. We want them to have a good time. But then we hone in on like the learning aspects and different objectives and things like that as well. But we really try to create a sense of teamwork while we're doing these simulation cases.
Yeah, and I love that. And I think one of the things that I think you just mentioned that I think is so valuable, and probably one of the most important things about SIM is the debrief, because I
Mhm.
think that can offer you a platform to essentially give medical students that early win, and just leading with, hey, here are the things that I think you guys did really well. Let's talk about that. Let's focus in on that before we talk about
Exactly.
the things that we can do better. And the debrief is something that I want to pick your brain about more because I think that tends to be one of the most impactful parts of SIM, because really that's where you can tie in all the mistakes and tying in all the successes and help residents grow, help other learners grow. From your standpoint, what makes a good debrief versus what makes a not so good debrief?
I think a not good debriefing would be one that's just jumbled and just all over the place for one.
Yep.
So that's why we have objectives. I think again, the objectives is what ordered objectives. I think is what really makes for a good debrief. Because a debrief, what it should be is it should just be a conversation based on these topics. And so a lot of times as the ER providers, those of us who are doing the sim with the residents or over them with it, we try our best to just start the discussion, but We do a lot of teaching here and there inside of the discussion of the debrief, but we let the residents kind of guide the discussion because once we start asking questions and do this, it's going to lead to this and this and this. And a lot of times they have the same questions that we want them to have. The debrief actually is able to prompt them to dive deeper into their brains and think about, exactly what they've done and what they're doing and why they're doing it in these simulation cases. And it ends up usually being a really good time. And sometimes we end up, having questions and different things that, we may all have to look up or, it creates an environment where you can hone in better on those skills per se.
Absolutely. And I think it also helps, especially the senior learners too. I think in a situation where odds are they're probably going to be debriefing with their staff members after a high stakes
Mhm.
case, high stakes resuscitation.
Uh,
So seeing attendings lead a debrief, I think is so
right.
valuable because then they can implement those skills into their clinical practice
Mhm.
for the time when there is no attending there and they're attendings on their own and they have to
Yeah.
have a debrief. I know for me personally, we've recently had some critically ill, high stakes resuscitations where afterwards I'm debriefing with my nurses, with my younger learners. And the only way I felt like I was able to succeed in those situations is because of the debriefs that I had in the past with my sim cases in the past. So, one of the things that I was actually going to pick your brain about, and now after you brought up the debrief, is can you give me a skeleton of what a good debrief looks like? Let's say I am your younger learner, I'm your intern. We just ran through a case and you're about to debrief with me. How would you do that in a way where I can take a lot out of the case?
Okay. So one of the first things that we would do is we would all, be back in our room. Okay. We'd sit down, we'd probably have a couple laughs. Say, okay, we'd start by saying, how do you all think you did in that case? How did it make you feel? What was your first thought when you walked into the room? And usually that's what breaks the ice for everyone because they're either just like, I was super nervous and I didn't know what was going on, or I was just like, I thought it was this and it was this. It creates a really good framework for the discussion. And after we ask that first question, how did you feel when you walk into the room? And then after they make their comments, then we can kind of go objective to objective. And honestly, sometimes those objectives just usually just fall right into place just based on the discussion. We'll start with, what did you notice, vital sign wise, what were some differentials that went through your head? And so those differentials, what we discuss in that from that time usually helps to guide the rest of the discussion. Because then once we get to the differentials, then we can get to, what lab tests are you thinking about? What imaging tests are you thinking about? What things should you do and what things should you not do? Okay, what would happen in the case if this patient were to decompensate? Or what do you do if this patient gets better? Do you still do this or should you still do this? So it creates a really good, I think a really good debrief is something that one starts with, how did you all do? Don't be stressed. This is great. This is a really good environment for you to learn. This is just a foundation. Now let's talk about what you thought, what you expected, what were some differentials that went through your head, and let's talk about the workup and managements of those.
Yeah, I love that. And I think that's a good framework to actually give the feedback that's necessary for growth, especially after a tough sim case. That's
Yeah.
usually my own approach as well as I ask residents, hey, what do you think went well with this sim case? Whether it's an oral board case or something else, I ask them, what do you think went well? Here's what I think you guys did well. What are some things that you guys think could have been done better? Here's what I think you guys could have been done better. And now, given all the information that we've gathered today and that we've worked on, let's talk about what we can take that's actionable and work on it for the next time that we run into this situation. So I think this was actually a really worthwhile discussion. And I think it really helps map out a good way to kind of structure these conversations. So I love that. Now, as time is kind of running low, one of the things that I wanted to pick your brain about is let's say if I'm a new sim director and I'm trying to integrate sim into my curriculum, what are some resources that you've used and that you would recommend to help with simulation integration into emergency medicine curriculums?
In sim cases is one of the websites that we use to kind of take old cases from, but then what we've done in the past is we've revamped those cases and added a few more complexities to them. We also build our own cases. We have residents throughout our residency program, second years, third years, who may have seen, a zebra case in the ED and they want us to implement it in one of our core curriculum sims, which is different than our regular didactic sim. So we have core curriculum sims and we have didactic sim. The core curriculum is what I mentioned earlier, the ones that you have to go through and, those ones that are on Wednesdays. But aside from those things, those are some really good resources that we use.
Yeah.
But it's mainly in-house and mainly in sim cases.
Love that. Things that I've utilized, I like the Inspire Network as well. They have a lot of good stuff out there. Emra has great sim kits as well, specifically for debriefing side of things, because I know that tends to be a challenge for a lot of educators is, hey, what are some guides that I can use to help myself debrief? I like the Pearls debriefing framework, and I also like the Dash approach, which
Uh,
is debriefing assessment and simulation for simulation in healthcare. And I think that tends to work out really well. And then I also personally like to go on YouTube and just try to find like equipment hacks. Because I think that tends to be really valuable. Trying to make your own little low fidelity mannequins. I remember I run the central line station for the interns for their duckling shifts when they start off. So I actually made one out of Jello, like an entire central line model, so that they could practice.
Oh, wow.
Because
Uh-huh.
realistically, I was like, man, the high fidelity mannequins we always do, so we might as well try something different. So I
Right.
spent one weekend with my dad, and we were just kind of cooking up some Jello and making like central line models that actually ended up working out really well. They started to smell towards the end of the station, but I was like, we're good. We can do that because I think with sim you can get really creative and you can kind of build your own thing, even if let's say you don't necessarily have the super expensive equipment out there. There's always
Mhm.
ways that you can improvise and MacGyver. Even like with lateral canthotomies, you can make your own little models that you can use and stuff. And I know folks have gotten very creative with it. So that actually ends up working out really well. So as we're getting ready to wrap up, Elton, one of the things that I ask every single one of my educators that I have on is if I am a first time listener, what are the three key big takeaways that I can take away from this episode?
Let's see here. The big three key takeaways. First one is emergency medicine is great. I'm kidding. Simulation is actually really important with helping with integrating skill sets and procedures, qualities within our residents. I believe that another big point to be taken away is, simulation doesn't just have to be, only mannequins. It can be, simulation, with procedures, simulation out in the field, simulation within your department, in these instances, which we also do as well. And I also think that from this takeaway is, make sure that you're, for those of us who are educators and those of us who will be, doing medical education simulation with the residents and with med students, make sure you're keeping an open approach, and just setting the stage for success. Let's not make these students nervous. Let's not make them, I mean, nervous to a certain extent because we're dealing with people's lives, but let's not make them like scared and nervous. We want them to have a great time, but we also want to make sure that they're actually finding this information in these simulations useful. And a lot of times that does come from, the educators themselves, comes from us, setting that stage and that framework for them.
I love that. And I think those would be some of my key takeaways as well. Creating that environment for learners where they can feel that they can make mistakes and learn from those
Exactly.
mistakes. Integration of not just high fidelity mannequins, but other tools that and individuals that you can utilize to basically help your learners grow, whether that's multidisciplinary teams or standardized patients. There's a lot of creative ways that you can go about it and utilize SIM to help your learners especially master high stakes resuscitations in a very low stakes environment. And I think that can be very helpful. One of my key takeaways from this episode, and I think you alluded to it several times, is the debrief. And I think that debrief is so, so key because that's an opportunity for us as educators to really tie in everything that is involved in the case, focus in and hone in on those objectives, make sure that the key takeaways that needed to be taken away from the case are actually emphasized and that our learners are understanding, hey, these are the things that you're doing really well, these are the things that you struggled with, and here are the things that we can build on for the next time we're in an actual situation like this. So I think that tends to be really valuable. And as we're getting ready to close up, Elton, any last minute thoughts, any last minute things about SIM that I didn't get a chance to ask you about that you want to talk about?
Sim is great.
I love that. I think that's a good way to kind of close up that. So, Elton, is there any place on social media where folks can reach out to you to pick your brain about simulation and integration of simulation if they have any questions?
You can always reach out to me at my Instagram, which is I_need_ATP. The science nerds will understand what that is. It's I_need ATP. But also my email address at any time if you want to reach out, that's going to be elton.banks@uky.edu. And then if you want to find our residency page, it is UKMRES, UKEMRES, and that is for the University of Kentucky. You'll be able to see our wonderful residents and our wonderful faculty and just the different things that we do at various times, whether it's simulation, whether it's out in the community, whether it's in a department. So yeah.
Awesome. Love it. And what I'll do is I'll link some of those resources in the show notes as well as some of the resources that you had mentioned in the show notes for anybody that's interested in trying to revamp their sim curriculum. So as we're getting ready to wrap up, to the listeners out there, let us know, what are you guys doing for sim? What have you guys incorporated into your curriculum to help your learners? What's worked for you? What hasn't worked for you? And let's keep this conversation going so that we can always learn and grow better as medical educators for our learners. Thank you guys for joining me. Follow us on Instagram, like us on YouTube, listen on Apple and Spotify. Thank you guys again for joining me for a fantastic episode. See you guys soon.